Good afternoon and welcome to this time of information and conversation that we hope is helpful for you as you prepare for the 2019 annual conference session. I deeply appreciate your willingness to serve as a member of the Indiana Annual Conference. Your presence and your discerning spirit are important to us as we make decisions and seek to follow where God is leading us. For those of you who don't know me, I'm Shannon Stringer, and I'm the Director of Leadership Development in our Indiana Conference, and it is my pleasure to be moderating today. Our theme this year for Annual Conference is From Water to Witness. It is our hope that from the waters of our baptism, we will be witnesses of Jesus Christ to the people we meet in all parts of our daily living. Our scripture guide is Ephesians 4 through 6. There is one body and one Spirit. Just as you were called to the one hope of your calling, one Lord, one faith, one baptism, one God and Father of us all, who is above all and through all and in all. Today we'll be having conversation around a new health insurance plan being recommended. We'll review the annual conference schedule, and we'll share information and instructions about our annual conference. We'll also share about the current reality of church after the 2019 special called General Conference. As we get ready to start, won't you pray with me? Gracious and almighty God, we ask for the anointing and blessing of your Spirit upon us here. You have promised us that when 2 or 3 or more are gathered, that you are with us, and we claim that promise. May the words that we speak be honoring to you and the lives that you have asked us to lead. May the information that is shared help us be faithful in carrying out and using the resources, being good stewards of what you have provided us. And may we find ourselves remembering who we are and whose we are. Amen. As a remembrance of exactly who we are and why we celebrate one Lord, one faith, and one baptism, I'm going to invite you to stand as you are able and share with me in the Nicene Creed once you stand together. We believe in one God, the Father, the Almighty, maker of heaven and earth, of all that is seen and unseen. We believe in one Lord, Jesus Christ, the only Son of God, eternally begotten of the Father, God from God, light from light, true God from true God, begotten, not made, of one being with the Father. Through him all things were made. For us and for our salvation, he came down from heaven, was incarnate of the Holy Spirit and the Virgin Mary, and became truly human. For our sake, he was crucified under Pontius Pilate. He suffered death and was buried. On the third day, he rose again. In accordance with the Scriptures, he ascended into heaven and is seated at the right hand of the Father. He will come again in glory to judge the living and the dead, and his kingdom will have no end. We believe in the Holy Spirit, the Lord, the giver of life, who protects the Father and the Son, who with the Father and the Son is worshiped and glorified, who has spoken through the prophets. We believe in the one holy Catholic and Apostolic Church. We acknowledge one baptism for the forgiveness of sins. We look for the resurrection of the dead and the life of the world to come. Amen. Won't you be seated and comfortable together? We're going to take a minute just to review who we are as the Indiana Conference, especially for those for whom this might be their first attending at annual conference. We are reminded that the mission of the annual conference is to make disciples of Christ for the transformation of the world by equipping its local churches for ministry and providing a connection for ministry beyond the local church, all to the glory of God. We are reminded that the vision of the annual conference is that we will be a connection of vibrant congregations with fruitful leaders and faithful disciples, transforming the world by doing no harm doing good, and staying in love with God. And finally, we are reminded that we do, in fact, have a wildly important goal. You may have heard that referred to as the WIG. The WIG for the Indiana Conference is to be missional, which we define as 100% of our churches and pastors being engaged in life-giving changes for Jesus Christ in their mission field. We ask that we would keep all these things in mind as we do our work as members of the Indiana Conference. And now it's my pleasure to introduce to you Ian Hall as he comes to talk to us about pensions and health benefits.
Well, good afternoon, everyone. And as Shannon said, I am here to talk to you guys about pension and health, and more specifically about health today. But I'm getting a little feedback up here, so I don't know if we can do anything about that, but there we go. Okay, so prior to today, we have been looking extensively at what it is to provide health benefits to both clergy and laity within the annual conference. And when I say we, I mean the Board of Pension and Health Benefits. So I thought it'd be helpful to just take a few minutes to talk about what the Board of Pension and Health Benefits does on behalf of the Indiana Conference. And I have some slides that we're going to go over today. But in a nutshell, one of the things the Board of Pension and Health Benefits is charged with doing is communicating to all of the agencies and individuals within the conference, whether that be the bishop or the cabinet or the laity or the clergy of the conference, information about healthcare benefits. And we do that through several different media. As with a lot of entities in the United Methodist Church, we are asked to do these things based on the Book of Discipline. So the Book of Discipline lays out a lot of different things that we, the Board of Pension and Health Benefits, should do. And one of those things we should do is basically establish guidelines that are necessary to provide that health care. We also, as it says here, provide basically a detailed report of all of the things that the Board of Pension and Health Benefits do in our wonderful Book of Discipline. That can be found in paragraph 639 of the current Book of Discipline. So, basically, we are charged with the oversight of not only healthcare, but pension. When it comes to reviewing our current healthcare benefits, there are a lot of reasons why we should overview and look at these benefits. For the past several years, the cost of health insurance has just been getting higher and higher, and that's not an Indiana Conference problem, and it's not even a United Methodist Church problem. It's, I dare say, systemic across the whole country. The cost of health insurance is getting higher and higher. It's becoming unaffordable for many, and that includes some of our lower paid clergy. Currently, you're also unable to opt out of the conference health insurance plan if you're a clergy person. So that's one of the other things we needed to review and look at. Many folks have other options for healthcare, maybe, but currently, if you're a full-time clergy person, you're required to be in the Indiana Conference health insurance program. There are also a limited number of health insurance benefit options currently. So looking at increasing that level of options is also something important to look at. And from a perspective of looking at our health insurance policies, this isn't something we just started to do last week. Since 2007, the end of 2007, the board has been looking at and reviewing what we currently offer and what options might be available in the future. So does all of that make sense? Okay, very good. So, looking at like the 30,000 foot level, healthcare insurance in the United States, so not just within our conference, but within the country. Basically, even though the gap has got a little closer, the cost of health insurance versus the increase in persons' wages has continued to grow. And so insurance has become more expensive. Most large employers in the United States of recent years have been transitioning their employees from what we might think of as a traditional insurance plan to a high deductible plan, which has basically higher deductibles and higher out-of-pocket expense, but it has lower premiums. Now, the Indiana Conference has stepped into that world, offering a couple of options that are cheaper, but fundamentally, we've not really embraced what corporate America has been doing. That's not to say we should embrace it, but we should at least have a look at it and look at the options. And basically, employers over years have basically been migrating from what are called HMOs, or health maintenance organizations, where you basically paid a fixed fee for insurance, and then you had your insurance. Be migrating from that to a PPO, which is a preferred provider organization, and in effect that's kind of a subscription level. You pay a certain amount of money up front and you get a large discount if you work with certain healthcare providers. So the first step was to transition from a HMO to a PPO, and then the next transition in that kind of time frame has been to go from PPOs to HDHPs. And, you know, as United Methodists, we like acronyms. We have lots of acronyms, so does healthcare. So I'm going to attempt to explain what all the acronyms are rather than just say them. So, for example, a HDHP is a high deductible health plan. So, over time, companies have transitioned from basically covering all of the expenses of someone for health insurance for a flat fee to a process where you paid a subscription fee and you got a guaranteed discount, and then transitioning to these high deductible plans. And what I am going to attempt to do this afternoon is talk you through those different options and look at what it might look like if the Indiana Conference adopts a similar plan. You may have heard of people talking about gold plans and silver plans and bronze plans. And one of the disadvantages of this vernacular is that we all think gold is best and that bronze is third best, silver's kind of the runner-up. The industry uses these terms, so we're going to continue to use these terms. But what I would say is that basically the mindset we need to be in is not that gold is best and that bronze is worst, but that there are different levels or different options for each consumer, and the industry has chosen gold, silver, bronze. So when we look at gold, these are the traditional PPO plans. There's a high premium, but there's the potential for a low deductible and a low out-of-pocket expense. Then when we look at silver, lower premiums than gold, but a higher deductible and a higher out-of-pocket expense. And then bronze is the lowest monthly premium, but has the highest deductible and highest out-of-pocket expense. And here in a little while, I'm going to go through some scenarios that show you that it's not necessarily, if I want the best coverage, I'm going to go with gold, because gold is the best, and I don't really mind paying a higher premium. The economics of it takes a little bit of explaining, but bronze isn't necessarily any less coverage. You're just choosing, much like you would with car insurance, to pay a lower monthly fee, but then when you have a car wreck, you have a higher deductible. Depending on how often you have a car wreck would determine how much money you spent. The same applies with the healthcare, with the exception that we're really talking about people's lives, not a piece of metal, right? So it's important to know all the factors about what coverage you need when you're making these decisions. So it's not one size fits all. So our current state. These are annual costs specifically to Indiana, There's a footnote there that says this does not include incapacity benefits. So the annual conference provides health insurance to clergy who are on incapacity leave. That costs about an additional $500,000 a year. But when we look at this pie chart, we are spending, in a nutshell, $10 million on healthcare every year. The blue box is claims, and as you can see, that's the majority of the expense. And then it's kind of silly to round $200,000, but when you look at the $9.2 million, you can see where I'm going. The majority of the expense is in claims. So folks often say our health insurance is rather expensive as an annual conference, but we're spending a lot of money. No one is making huge profits with the fees that we're charging for health insurance. It's literally covering the costs. This is 2018 data, and as you can see, basically every individual within the plan paid by the annual conference about $7,300 for their care. So care is just expensive. And as I said, the trends for the nation are that it just keeps on getting more and more expensive. And even though our costs are pooled with other annual conferences, and what I mean by pooled is we basically pay for expenses until they get to a certain expense level. Let's just say they get to $500,000. When it gets to $500,000, this is just a hypothetical, that risk is then split amongst all the annual conferences that have pooled our resources together. So the cost of insurance in the next year is based on the experience of the prior year. So when you have a lot of expenses, your premiums go up. If you have a lower level of expense, the premiums stay static or go up less. Now, to basically make sure your fees don't go up dramatically, we pool the larger expenses with other annual conferences, and everyone shares the burden of those high expenses. Does that make sense? Okay, so insurance costs a lot of money. Currently, there are 3 different health plans available to clergy and lay employees of the annual conference. The B1000 is the PPO traditional plan that a lot of folks are in, and then there are 2 different high deductible plans. There's a CDHP 2000 and there's a HDHP 1500. The difference between those 2 is the mechanism by which you can save money for health expenses. One has a HRA, which stands for Health Reimbursement Account. So basically, as you spend money on healthcare, you can be reimbursed from that account. The other one is a health savings account, which allows you to save money over time for health-related expenses. And the nuance between the 2 is, one, if you don't have things to be reimbursed for, you can't access that money. The other, you can grow over time and you can shelter it from taxation and use it for healthcare expenses a long way down the road. So it becomes basically a saving mechanism for healthcare in retirement. So 2 different plans. One, I would argue, is more preferable than the other, and that's the savings account rather than the reimbursement account. We currently have 1 dental plan and we have 1 vision plan. Those are rolled into the premium that everybody pays. So you choose between a traditional plan or one of 2 high deductible plans. And with those 3 plans, you get vision and dental included in the cost. All of this is administered by WesPath. So who is WesPath? Well, WesPath formerly was the General Board of Pension and Health Benefits. And several years ago, they rebranded themselves to be called WesPath. And basically, WesPath is taking from our Wesleyan tradition. The first part of it is Wes, for John Wesley. The second part, path, is a path or a road forward, and so it's a nod to the Wesleyan tradition of the United Methodist Church, and with all benefits, pension and health, you're looking forward to the future. So that's WesPath, or at least that's how it was explained to me. They are a general agency of the United Methodist Church, and basically they provide all of the administration for conference benefits, and when it comes to retirement, for all conferences. When it comes to health benefits, as it says up here, 32 plans are within the system. It's not mandated that an annual conference utilize WesPath. I believe it's 30 conferences do, and there are 2 general agencies utilizing them, but don't quote me on that. 100,000 participants, it's a big one, almost $22 billion of assets that are managed by WesPath, 250 employees, and last statistic about them, they're the largest reporting, so they report their details out to everybody. There's a couple of other funds that are more secretive and don't do that, but they're the largest faith-based benefit administration organization in the country. So, I'm not going to talk to you about the way forward today and the special called session of General Conference, but what I would say is when it comes to managing the United Methodist Church's assets from a benefit and pension standpoint, we're in good hands with WesPath. They have very good employees, they have a lot of expertise, and as an annual conference, we lean heavily on them for some of those expertise. So, what do they provide for us? Well, they provide several things. Basically, they do a lot of the heavy lifting for us. So they select the vendors that provide these benefits for us, and they oversee the selection of pharmacies and behavioral health specialists, anything related to the healthcare industry that we deal with, they provide us. And then down to, it says, the reimbursement accounts. So whether that be a flexible spending account or a reimbursement account or a savings account, they manage all of that for the annual conference. The annual conference has dedicated customer service support from WesPath. They also help us communicate with all of the participants. One of the things they provide is Alex. And if you haven't seen it, Alex is this jumping jelly bean that asks you questions, and based on your answers to its questions, recommends which health plan may best suit your needs. So that's an interactive kind of fun thing, but it does give you the ability to look at the different options and make a wise choice. I already mentioned that we have high-cost claim pooling with other annual conferences. WesPath oversees that. They also provide us with legal support, training, communication. They do the billing. So basically, WesPath does a lot of work for the annual conference, and we greatly appreciate it. When it comes to what I'm going to talk to you about now, the Health Exchange Program, in 2017, we were approached by WesPath about this new option, and so we spent the last couple of years looking at what that might be. So, does anyone have any questions thus far? That's okay, that's fine. But feel free to interrupt if you do have a question. When it comes to the Health Flex Exchange, basically what we're doing is increasing the opportunity for participants to make choices. So we go from 3 plans to 6 plans, and currently we have basically 3 gold plans. So we're adding bronze and silver plans. There will be 3 dental plans and 3 vision plans that people will also be able to choose from. And so basically, choice is the word here. We're giving participants the options to choose what best meets their family's needs. 6 plans, and I've already gone over the acronyms, but basically, we're going to have a traditional PPO plan. Then we're going to have a couple of consumer-driven health plans and a few high-deductible health plans. And so, as you can see, 3 gold, 2 silver, 1 bronze. When it comes to how we've been evaluating
the current status of healthcare and where we're going in the future, it can be summarized in basically 3 different areas. The first area is that we could go independent. We could basically leave Wespath and we could establish our own health insurance program. And there are several annual conferences a few years ago that went that route. We could maintain the current status quo. The Health Flex program that we are enrolled in currently will be available next year. The caveat is that the following year, 2021, it won't be. Wespath is suggesting you move there next year. They're mandating, if you stay with Wespath, that in 2021 you adopt that plan. And then the third option is to adopt the Health Flex exchange program this year. And so I'm going to share with you some pros and cons of each. So, go independent. The major pro of going independent is that we would basically have 100% control of the plan and all the parts of it. I could have just done a slide that said the main con is that we maintain 100% of the control of the plan, but we've gone into a little bit more detail. Basically, if we have 100% control of the plan, we're going to need to increase staffing. We don't have enough staff to provide that benefit as it currently stands. There's the value-added products that I just talked about from all of the administration and the cost pooling that would go away if we went on our own way. And I think it would be a significant change for our participants who are currently enrolled in the program. The other thing to factor in here is that every few years, at least since I've been in my current role, we have looked at what it would cost to go independent and move to another provider. Because the feedback we always get is health insurance is really expensive. What can we do about that? So, this is 2 years ago. 2 years ago, we contacted the 2 largest healthcare providers in the country, United Health and Anthem. And basically, you can give them some statistical information about your pool, the group of people, and then you can ask them to give you a quote on what it would cost to provide A, B, and C. So we basically said, to provide the current coverage we have for this pool of people, what would it cost? And I don't remember which one of them laughed and said, we won't even give you a price, but one of them did, and then the other one said it would be twice as expensive. So, when it goes to going independent, it's expensive, and it would be a big change. Maintaining the current status quo. Basically, there'd be no change next year, and so there'd be no need to communicate any change, because there wouldn't be one. It'd be the same as we have been used to for at least 10 years since we started the Indiana conference program that covered the entire state. In effect, this would be a 1-year delay. That's a con. We'd still be doing this, or at least having to discuss this in the following year, and it would narrow our choices to doing this program or going independent. If we don't change next year, it restricts choice to individuals. And as it currently stands, there'd be a minimum of an 11% increase in the cost of insurance for our local church, and the costs for individuals would also be rising. So, the pros are that there'd be no change. The cons are that we'd see increasing in price, and we'd basically be just putting a Band-Aid on it, I guess. When it comes to pros and cons for the Health Flex exchange, we're estimating that the 2020 church portion of the premium would only increase by 4%. Participants would have access to a range of different plans, depending on their need and their budget. we would continue to utilize Westpath to administer the plan. And even though our enrollment pattern would change because there'd be more options, participants would be used to the system of enrollment. The big con to the transition is one of communication. It's going to take a lot of time and energy to communicate the why behind why we're changing. And so part of today is about the why. This new model, the Health Flex Exchange model, revolves around a premium credit. And it basically gives each participant an amount of money to shop for health insurance. It's a fixed dollar amount that comes from the annual conference, which is funded by the local church. And it's basically a new approach to cost sharing. In the past, when it comes to the rates that you pay for health insurance, we've been giving each individual what is called a blended rate. We basically take the costs for different levels of insurance, roll them together, and blend the rate depending on whether you're a single person, whether you're a person with one additional person, or you're a family. So we have 1, 2, and then 2+. And those rates have all been blended. What you're going to see if we go to a health exchange is basically the cost of everything will be laid out in front of you. It'll be very transparent. We won't be blending in the cost of vision and dental. It'll all be shown as items that you can choose, and you'll get a fixed dollar amount based on the category that you fit in to reduce that expense. So when it comes to the model, basically 6 medical plans, 3 dental plans, 3 vision plans. You can choose the gold, higher premium but lower out of pocket, or you can choose the silver or bronze, which has a lower premium monthly cost but a higher out of pocket. And made these nifty little graphics, so you have options for a 1, 2, or a family. And basically the premium costs what the premium costs. You then get a credit, and the difference between the premium and the credit is the amount that you contribute on a monthly basis. We've got basically 3 premium credit models or levels. A single person would receive a premium credit of $618. A family of 2 would receive a premium credit of $1,135, and then a family, 2+, receives a premium credit of $1,560. And so I've got I promised you some examples. So I've created some examples. So this is Pastor Jane, and Pastor Jane is a single person, and she's basically trying to make the decision between her current plan, which is the traditional gold PPO plan, and then a high deductible plan, which is a silver plan, and it has attached to it a health savings account. And we're going to assume that Jane spends $2,000 on in-network healthcare in the year. So, I think I can use no, that's not the pointer. That is. Okay, can we all look at this one rather than that screen? Okay, so in a nutshell, Jane is making a decision. Jane's monthly premiums, if she went with the PPO plan, she'd be paying $364. If she goes with the silver plan, she's paying $290. And so we basically take those premiums, we times them by 12, and we can see that the differential factor between the traditional plan and the high deductible plan, she pays $888 less for the high deductible plan than the other plan. With high deductible plans, the organization provides you with some seed money into their savings account on January 1. So she receives $750 of money into her health savings account on January 1. She has a $1,000 deductible. She has a $1,500 deductible. Once she's met her deductible, in both plans, there's a split of 80-20. But because the high deductible plan has a higher deductible, she's going to, of the total $2,000, she's going to pay $100 for co-insurance in this scenario and $200 in this scenario. When it comes down to the bottom, you see the total out-of-pocket, which is basically the cost of the monthly premium plus the cost of purchasing the additional services. And you see that if she switches from the B1000 to the H1500, she'll save $1,238 or 22%. So in this particular scenario, she switches from one plan to the other and saves money. Yes?
Sorry, can you explain the co-insurance? I don't think I've ever understood that.
Certainly. Okay, so with health insurance, you have the several factors, but you're going to pay a deductible. And let's just make it simple. So if you've got $2,000 worth of expenses and your deductible is $1,000, the first $1,000 of that $2,000, you pay every penny of it. And so you'll get a bill, you pay the $1,000. Then you've got another $1,000 of expense, and that is split on a ratio. In this plan, it's an 80-20 ratio. So for every $100 that you spend above your deductible, you spend 20, and the health insurance company spends 80. Now, the one factor that's not on here is total out-of-pocket expense, because you get to a point with health insurance where annually there's a total out-of-pocket expense, and so let's say it's $3,000. So the first $1,000 you pay yourself. The next $2,000 is split 80-20, and then once you reach the $3,001 mark, the health insurance provider pays the whole bill beyond that. So it's kind of three numbers: your deductible, your co-insurance or the split, and then your total out-of-pocket. And so your total out-of-pocket is something to factor in when you're talking about making these decisions. Does that make sense?
I do.
Great.
Is the total out-of-pocket the same for those two plans?
It is not. So your total out-of-pocket for the traditional plan is less than your total out-of-pocket for the high deductible. And I was waiting for someone to ask this question, so I'll put my bid in here. So Jane saved $1,238. If she was in this particular scenario, the H1500, the total out-of-pocket for that single person is $3,000. I cannot mandate what Jane does with that savings, but here's what I'd recommend she do with those savings. Fund her health savings account. And so in year one, she would not save any money because she'd basically be paying the same amount she'd paid the prior year. But let's say she has this same kind of behavior when it comes to spending. Within a couple of years, she will have a health savings account with a balance of $3,000 in it. And in effect, what she's just done is become self-insured from a standpoint of her total out-of-pocket expense. Because she could have a terrible year in year 3, but she's set aside $3,000 in that health savings account, which would cover that, which means that from a day-to-day expense standpoint, she doesn't have to find $3,000. She doesn't have to find any dollars. She's got the money set aside. Now, the federal government kind of mandates how much you can put into one of those accounts on a yearly basis, currently $7,000, and that's pre-tax, so you need to consult a tax expert when it comes to what the actual cost of doing that is. But what I will do personally is continue to contribute to that health savings account because it is going to accrue money over time. And so get to the point where you're self-insured and then kind of make a decision as to whether you can afford to continue to contribute to that. So, when it comes to two persons, we've got another scenario here. We've got Pastor Joe and Julie, his wife, and basically they're trying to make a decision too. They currently have a silver high deductible plan. They're looking at what a bronze deductible plan would do to their finances. As the scenario says, they're in good health and they're going to spend approximately $2,000 a year on their health expenses. Same table, similar scenario. We look at the monthly premiums. When we look at the difference between the two, you see a savings of $3,744. You'll notice here that the funds that are deposited for you in the silver plans are significantly more than the funds that are deposited in the bronze plans. And the deductible is higher in the bronze plan than the silver plan. We see the split here. We've noted that in this scenario, they haven't even met the deductible, so the split doesn't take effect. But in this scenario, when they spend $2,000 on healthcare, even with the lower contribution and then a higher deductible, you see a savings of 30% or $1,844. So in their instance, flipping from one plan to the other makes a lot of sense. We've got a couple of lay people, and Karen and her family are again contemplating switching from a gold plan to a bronze plan. But in this scenario, one of the children has basically damaged themselves, and it's going to cost them $10,000 to fix that problem. We run the numbers, and what we find here is that ultimately there's a savings of 25% or $3,628. But that's just one little boy or little girl breaking their leg playing soccer, right? So it's going to cost something, but it's not a reoccurring expense. What I would say is that the high deductible plans are not for everybody. There are going to be some people who have ongoing medical expenses that the PPO, the gold plan, is the plan that we would recommend and that Alex, the dancing jelly bean, is going to recommend that you stay in. And in this scenario, we're not taking that away. So the cost of healthcare, in effect, we can't control the cost of the healthcare, but we can control how much you pay up front and then how much you pay out of pocket, and it's a balancing act. But if you have ongoing medical concerns, these savings may not be the right direction for you. So, in a nutshell, when we look at the advantages of transitioning from our current program to the health exchange program, we're estimating that basically there'd be a 4% increase in the premium allocated to the local church versus an 11% kind of at a minimum. It improves the level of choice. Going to reiterate that the gold plans are still available for those who either choose to want a gold plan or maybe even need a gold plan. Silver plans and bronze plans will now be available, which give people the choice of a basically lower premium, higher deductible. And this is the recommendation, you probably guessed from all of the things that I said, that the Board of Pension and Health Benefits is suggesting that we go. I also talked earlier about opt-outs and the fact that currently that hasn't been available. So past current practice has been that you basically cannot opt out of the health insurance program. And there's been multiple reasons for that. One is the covenantal connection of clergy. Basically, every clergy person should be able to have health insurance, and in the past and currently, the decision has been made that the funding mechanism for that is that everybody is in. It provides for equity amongst churches, whether a church has 20 members or 20,000 members, it's the same cost. When it comes to making appointments, the family status of a clergy person is not affected by the current way that we fund health insurance. So whether you have a single clergy person or a clergy person with 20 children, it's the same level of coverage. And in a nutshell, there was no way to opt out. So no waiver provided by Westpath. That said, in 2017, Westpath made a waiver available. They basically said that if you have a former or current employee that can provide insurance, you can opt out. If you have a spouse that has insurance, you can opt out. If you're either currently serving in the armed forces or were eligible because you did to TRICARE or campus, then you can opt out. And Medicare and Medicaid eligible folks could also opt out. They also said this is to the discretion of the annual conference. So what Indiana said was basically you can opt out, but only if you're eligible for TRICARE, campus, the military benefit, or Medicare or Medicaid. As we look at providing the health exchange program, we're basically saying that moving forward, in addition to having the exchange, we would also have the option for clergy to opt out based on the waiver provided by Westpath. So, if you have coverage available from a former or current employee, if your spouse is eligible, or if you have military benefit, Medicare, Medicaid, you could opt out of insurance. There is a benefit that is available to clergy and also lay employees through IU Health that is only available to clergy if you're in the plan. And so if you trace IU Health backwards through a few mergers, you get to Methodist Hospital, and the Methodist Hospital agreement that basically said inpatient services from a room and board standpoint are written off for clergy. That's a huge benefit for folks when they have inpatient service. You do have to meet your deductible to be eligible for that, but if you're having inpatient service, you're going to have met your deductible. So it's important to remind people that if you opt out, you lose that benefit. But you could opt out. Now, under that proposal, there's basically going to be a fixed amount or share that each local church puts into a pool to cover health insurance for all, including those on incapacity benefit. And so even though the individual can opt out, the local church with a full-time elder is going to contribute $1,300 approximately monthly to the pool. So when it comes to opting out, the church isn't opting out, the individual is opting out. One more quick example. Basically, Mark and Maria are a clergy couple. They serve two churches, and they have the PPO plan. As it currently stands, both of them are required to have health insurance. So one, in this scenario, would have coverage for the family, and then the other would have coverage for a single person because both are required to have insurance, part of the deal. So, as you see here, without a waiver, Mark is paying the family amount, Maria is paying the single amount. It comes down here. Their total expense is $16,284. With the waiver, basically you see that Maria doesn't pay anything. She's now part of Mark's plan, and they save $4,300 a year. So this has been something that clergy couples have been concerned about over time, and it's something that this new plan addresses. Yes?
With or without the waiver, the local church still is responsible for covering the insurance for the conference?
Yes. So basically, under this proposal, all churches will contribute the same amount, regardless of whether their clergy person is taking the benefit. Because what we're saying is that the cost per month is not the cost for providing health insurance for your individual clergy person. It's part of the connectional relationship that pools funds to provide coverage for everybody. And so $1,300 is the number, and whether your clergy person opts in or out, you go back to the slide that talks about all the benefits of a mandatory plan, all the benefits remain, but it's giving the individual the options to opt out.
And that's $1,300 per clergy person.
Correct. Yeah. So, moving forwards, I'm more than happy to answer questions, but I have basically a timeline of what we're looking at doing from a communication standpoint over the next few months. Because, as I said before, health insurance is an important part of people's lives, and we don't just want to mess with people's stuff. We want to communicate how it's working and have lots of opportunities for people to ask questions and learn about the program. So, in the next few weeks, we're having 6 sessions, much like this. Another one is, well, maybe we're done because we're in a different time zone, but there's up in Noblesville today, another session about this. At annual conference, we will present some of this information in a little more detail for the floor to engage in and decide. Once we have made a decision, and let's assume that we adopt an exchange program, the next step is basically communicating with all of the participants, that being the local church and also the individuals that have the insurance, about what these changes are going to happen. There are going to be additional regional meetings throughout the state that will help inform individuals about the health exchange program and what options may or may not be good for them. And as this is a very personal decision, we're going to make sure there's plenty of people available to have one-on-one conversations. Alex, the dancing jelly bean, will help people. But if there are people with more nuanced approaches and more delicate questions, if you will, we'll have people available from Westpath and also from the conference center available to talk to folks. And then basically open enrollment will not change. Late October, early November, people will need to make their decision for their health care benefits. If people want to stay with a PPO, they can. There will be an increase in premium, as there has been over the years, but they can also offset that increase by choosing other options. Any questions?
Are there any differences in the pharmacy benefit between the plans?
Yes, there are. And that's why it's going to be helpful to talk to individuals. They're basically, with the higher deductible plans, they are encouraging the use of generic drugs as opposed to non-generics. So it will be important to communicate, to sit down with the person and say, hey, here's my health care costs, but then here's my list of drugs that I need to take. And there's a portal that says, hey, if you're taking this drug, you can take this drug and it's the same drug, or if you're taking this drug and there is no other option, maybe it's better that you stay with the PPO. Because the thing about the way they fund the medication is you have to meet your deductible before you start getting any kind of one-on-one dollar change. Now, if you are relatively healthy but you have asthma, for example, and there are some asthma medications that are not generic, but we can run a scenario that shows you that the asthma medicine, even though it's more expensive, you're getting 90 days prescription level at X number of dollars. But when you get to December, everything else being equal, you've still saved money. But we can run those scenarios on all kinds of drugs and say, yes, it's a good idea, or no, the PPO is a better idea. So, Greg.
Ian, do you have any ballpark figures on the total out-of-pocket costs for the other plans, the additional plans?
Not off the top of my head, but I can show you. Yeah. So the plan is at annual conference to have basically a grid that shows you what all that information is. But for a family, I don't quote me on this, but I believe it's $3,000 for the individual with a total of $6,000 for the family. That makes sense? So each individual has a $3,000, but it caps at $6,000.
It's sort of real-time feedback. At annual conference,
Yeah.
it would feel a little bit less like the possibility that we're stepping off a cliff if we had that number rather than some sort of unnamed, this is going to be higher, but it would be, we don't know whether it's 3,000 or 20,000.
Okay. Yeah. Thank you. Any other questions? Okay, well, I really appreciate you guys coming out today to learn about this. The more we can bring people up to speed before annual conference, I think the more informed discussion we can have at annual conference rather than learning this information at annual conference. And I keep on being told by Cindy Reynolds that I have 1 hour at annual conference. Thank you. Yes. Well, Shannon?
Thank you, Ian. I really appreciate your time and your presentation. This is the third time I've seen this presentation, and I think I'm starting to understand it. I particularly appreciate those of you who are here who are laity and the attention that you pay to health coverage that does not directly impact your life. I've been a clergy person for a couple of decades. I have raised my children with UMC healthcare. We have some long-term and difficult health issues in my family, and I'm really appreciative for the decisions that have been made on the floor by delegates and representatives to annual conference when I did not understand what they were talking about, and it didn't always make sense to me. And so I appreciate that you're here. I appreciate that you're paying attention. I invite you to share with others what it is that you have learned and what you have seen. Now it's time for us to talk a little bit about annual conference itself. I want to lift up a few things about this year's annual conference session, which is being held at the Indianapolis Convention Center from June 12th through the 15th. The theme is From Water to Witness. The guiding scripture is Ephesians 4:5. You should have received an information booklet in the mail. It looks like this. If you got a thin white envelope in this shape and you haven't opened it yet, that's probably what's in it. If you don't have one yet, you're going to want to call the conference office and see what happened and where yours are. Please read it carefully as you prepare for annual conference, and I recommend that you bring it with you. We begin on Wednesday, June 12th at 7 p.m. with worship. It is a day earlier than usual, but you're not going to want to miss the celebration on Wednesday night. The celebratory worship that is planned is inspiring, and afterwards, perhaps even more inspiring, we will be having ice cream. On Thursday morning, there'll be an orientation for first-time members of annual conference. This is at 8:30 in the morning in rooms 231 and 232. This is not on the schedule. So I'm going to repeat it in case you were like, why is she going over the schedule? We're going to get it. This is not on the schedule. So if you or anyone you know is attending annual conference for the first time, they're going to want on Thursday morning at 8:30 to be in rooms 231 or 232. They can also, of course, ask that question at registration. If you're new, you're going to want to make sure that you've got that time down. At 9:30 in the morning, we'll be having a worship gathering to honor those who are retiring this year, and that will be followed by our first plenary session. For anyone who may not have attended annual conference before, plenary is business. So that's the time when you're likely to need to vote. You'll be hearing about things that are relevant to the lives of the church, lives of the clergy, the laity, the individuals. There'll be some reports, but also petitions will be heard. The clergy and laity sessions will be on Thursday afternoon at 3 o'clock. Ordination and the celebration of ministry worship will be on Thursday at 7 o'clock, and Bishop Trimble will be preaching. By having this worship on Thursday night, we are absolutely certain that there will be no question over voting privileges for those who are commissioned, and then those who are ordained would also be eligible to serve if elected. On Friday, we'll begin with a meet and greet at 8 a.m. This is an opportunity for you to have conversation with those people who have indicated their willingness to serve as a delegate to the 2020 General and Jurisdictional Conferences. Your schedule has this on Thursday morning, and that is an error. Meet and greet is on Friday morning. This is followed by a day of plenary sessions that will include voting for delegates, processing 7 petitions, and doing the business of the conference, some breaks, and worship and Bible study. It will be a full day. The celebration of life worship to remember those who have gone to their heavenly home already will be on Friday night. The Reverend Karen Kelch will be preaching. Bishop Mike Coyner, retired from the Indiana Conference, will be speaking at the prayer breakfast on Saturday morning, beginning at 7:30 in the morning. The plenary that day will begin at 9 a.m., and it is our hope to be finished with all the business by 1 o'clock in the afternoon on Saturday. It will be another full day. There is some additional information. This year we will be using electronic voting for all items at annual conference. You will be given a voting device when you register, and you will be responsible for that voting device, and you must turn it in when you leave. We have 7 petitions to process. They're all online for you to see. If you go to inumc.org and you search AC, standing for Annual Conference Information, you'll find all kinds of things, including the petitions that you're looking for. We will elect general and jurisdictional delegates for the 2020 General and Jurisdictional Conferences. We'll be voting for delegates throughout the plenary time with the first ballot on Friday morning. And I don't know how many of you know, but Jurisdictional Conference will be in Indiana this year. It'll be in Fort Wayne, and so we're excited about it coming here. I encourage you to go online and to read the profiles for those who have submitted willingness to serve forms. It is absolutely your responsibility to take the initiative to get to know the people for whom you will vote. There is a mission project this year. The mission project is the collection of lap blankets that will be distributed to Brianna's Hope Ministry. That's a ministry that serves people in recovery from opioid addiction. This will be our last year to hold the annual conference session at the Indianapolis Convention Center. We've heard the many voices stressing the expense of meeting in downtown Indianapolis, and we did a statewide search. And for my friends who are down here in the far south, we really did a statewide search. It's hard to find a place that both has the capacity to seat everybody who needs to be seated and to have the breakout rooms we need and to have the possibility of feeding. It's not easy to do. And so we did a statewide search for facilities that would reduce the cost of annual conference and provide the space we need for our work. And we'll talk more about this at this year's annual conference. This will be a year of working and celebrating. We will celebrate as people come together, called United Methodists, in the state of Indiana. We believe in one Lord, one faith, and one baptism. We know that the waters of our baptism move us to witness for Jesus. And as we cling to that, we turn to a few words about our 2019 General Conference. Recognize that you may have concerns that come from our current denominational challenges. We acknowledge that our denomination is in an anxious and a painful place. During this time, our Indiana leadership is committed to working together as we focus on our mission to make disciples and be missional in all communities. We will continue to find ways to see all the people and to promote the unity of the church. Bishop Trimble encourages us all to pick up this challenge and to remember that being a witness for Jesus Christ is primary. It's the most important thing we do. Bishops preside at general conference sessions, but they don't vote. The number of delegates for General Conference 2019 was set at 864. About 58%, 504 of them, were from the United States, and 30%, 260, were from Africa. The remaining delegates, 90, are from the Philippines, Europe, Eurasia, as well as 10 from concordant churches with which the United Methodist Church has formal relationships. 31 delegates were absent during General Conference, mostly because they could not obtain visas. There are no constitutional votes as the result of 2019 General Conference. 2 petitions were presented by Westpath, the general agency for the United Methodist Church that cares for pensions and health benefits that Ian has been talking about today. Both of these petitions passed, and they will be implemented January 1st, 2020. Petition number 90016 established guidelines for churches that may leave the denomination, requiring that they pay pro rata shares of pensions liability along with whatever the annual conference where they are located may require as part of the process for leaving. Petition 90017 established the criteria for how pensions will be handled if clergy leave the denomination. Clergy will be treated as fully vested, having their pension benefits converted to the actuarial equivalent balance, which can continue to be invested in their personal defined contribution account through Westpath. In addition to these petitions, number 90066, called disaffiliation, was approved as amended. This petition outlined the process for congregations to disaffiliate with the United Methodist Church. This petition was sent to the Judicial Council, who met April 23rd through the 25th for a declaratory ruling on its constitutionality. At the 2019 General Conference, the delegates voted to support what is known as the traditional plan that contained several petitions. The plan does not change the historic United Methodist understanding of human sexuality. It does expand the definition of homosexuality and provides a stricter plan for accountability for those who violate the discipline. The General Conference referred the plan to the Judicial Council, who met April 23rd through the 25th for a declaratory ruling on its constitutionality. This is what we know at this time about the Judicial Council's declaratory statements. You can go to judicialcouncilumc.org to read their statement. You can visit www.umc.org/Judicial Council. On Friday, April the 26th, the ruling from the Judicial Council was published. You can find it at the website I just listed. The Council of Bishops have also made a statement, and you can find that posted on our Indiana Conference webpage, which is inumc.org. First, I invite us to remember that all new constitutional items go into effect January 1st, 2020. There are no immediate changes or implementations. Second, there is no action that will be at the 2019 annual conference related to the changes in the discipline. Third, you will read many media posts and articles about what the rulings mean. We encourage you not to let the many voices distract you from the one voice, the voice of Christ, who calls and sends us to our mission fields to make disciples for Jesus Christ, for the transformation of the world. In general, the disaffiliation plan is constitutional and is now the responsibility of the annual conference board of trustees to discern specifics for the Indiana Conference. All but 7 petitions in the traditional plan are constitutional. This is aligned with previous rulings from the Judicial Council. We will work with all effective entities and ministry groups in the Indiana Conference to help them understand and be ready to implement January 1st, 2020. In the coming weeks, we will make clear to everyone the processes and changes as we are committed to supporting the discipline of the church in Indiana. Many people are talking about the impact of the 2020 General Conference. And therefore, we ask you to continue to be in prayer for our church as we move forward in this time. Bishop Trimble has said to us that this is, and I quote, a time to pray and continue to focus on our public mission of making disciples of Christ for the transformation of the world. Let us continue our journey to be missional and embrace our Wesleyan pursuit of scriptural and social holiness. May we, as John Wesley instructed, watch over one another in love. Ending his quote. I thank you for coming today. I look forward to seeing you in Indianapolis on June 12th. I'm going to invite us to stand and pray the Lord's Prayer together. And then I'm going to ask if you have questions or other comments that you'd like to make before we go. Won't you stand together? Our Father, who art in heaven, hallowed be thy name. Thy kingdom come, thy will be done, on earth as it is in heaven. Give us this day our daily bread, and forgive us our trespasses, as we forgive those who trespass against us. And lead us not into temptation, but deliver us from evil. For thine is the kingdom, and the power, and the glory forever. Amen.